Dementia is one of the most common and most feared brain problems in the world. But what is dementia? Why does it happen? And what can be done to help the people affected and their families? Today on Atom of Curiosity, we'll explain the science, the signs, the care, and the hope behind dementia in plain, respectful language. Before we continue, if this is your first time on this channel, you are welcome, like, and subscribe to this channel so you don't miss a thing as we grow together. Thank you. So let's dive right in. For a clear understanding, this video will be broken into parts. Part 1. What is dementia? According to World Health Organization, dementia is not a single disease. It's a collection of symptoms, problems with memory, thinking, language, judgment, and the ability to carry out everyday activities that are severe enough to interfere with daily life. Dementia usually gets worse over time and mainly affects older people, although it is not a normal part of aging. Part 2. What are the main types of dementia? There are several causes of dementia. The most common is Alzheimer's disease, but there are other major types too. Alzheimer's disease, the most common form, characterized by the buildup of abnormal proteins in the brain that interfere with neurons and their connections. Vascular dementia, caused by reduced blood flow to the brain, for example after strokes or from chronic small vessel disease. Lewy body dementia, linked to unusual protein deposits called Lewy bodies and often includes visual hallucinations and movement symptoms. Frontotemporal dementia affects the frontal and temporal lobes, producing early changes in personality, behavior, or language. Mixed dementia, where more than one process, for example Alzheimer's plus vascular changes, is present. Part 3. How dementia affects the brain. At a biological level, dementia usually begins with damage to neurons, the brain's cells, and their connections. Different diseases damage different brain areas first, which is why symptoms vary. For example, Alzheimer's disease often first affects areas involved in memory and learning. That's why short-term memory loss is often an early sign. In vascular dementia, symptoms depend on where blood flow was reduced. A small stroke can cause sudden changes, while chronic vessel disease causes a slower decline. Part 4. What are the early signs and symptoms? Early signs can be subtle. Common red flags include increasing memory problems that interfere with daily life, forgetting recent conversations, appointments, difficulty performing familiar tasks like cooking or managing money, trouble finding words or following conversations, confusion about place or time, changes in mood, personality, or social withdrawal. If someone shows these changes, it's important to seek medical evaluation. Early assessment can uncover treatable causes and help plan care. Part 5. How dementia is diagnosed. Diagnosis is a step-by-step process. Doctors start with a detailed history and cognitive screening tests, then look for reversible causes, such as vitamin deficiencies, thyroid problems, infections, or medication effects. Imaging, CT or MRI, can show strokes, atrophy, or other structural changes. More advanced tests, like PET scans or cerebrospinal fluid analysis, can identify Alzheimer's specific patterns, and new blood-based tests to detect disease markers are emerging in research and clinical practice. Only a doctor can make a formal diagnosis. If you suspect a problem, ask your clinician for a cognitive workup. Part 6. Current treatments and what they do. Right now, there's no cure for most dementias, but there are treatments that can help manage symptoms and in some cases slow decline. Medication can help with memory or behavior in some people. Non-drug approaches, structured routines, physical activity, social engagement, sleep, and treating other health problems are also powerful tools. Research into disease-modifying treatments, those that target the disease process itself, is active and progressing but remains complex. Part 7. Risk factors and prevention, practical steps. Dementia risk is shaped by genetics, age, and many lifestyle and health factors. Recent evidence suggests a surprisingly large share of dementia cases could be delayed or reduced by addressing modifiable risks. Major risk factors include high blood pressure, diabetes, obesity, smoking, physical inactivity, hearing loss, and social isolation. Activities that protect brain health include staying physically active, controlling cardiovascular risk factors, keeping mentally and socially engaged, protecting hearing, and avoiding tobacco and excessive alcohol. Public health research now estimates that addressing multiple lifestyle and health factors could prevent or delay a substantial number of cases. Practical tips: exercise, healthy diet, manage BP, sugar, lipids, treat hearing loss, stay socially connected, lifelong learning. Part 8: Living with dementia, care, safety and communication, empathy, plus practical guidance. Dementia affects the whole family. Good care focuses on dignity, routine, safety, and support. Environment and routines, predictable schedules, clear cues, remove hazards. Communication: speak clearly, use simple sentences, be patient, focus on feelings, not facts. Behavior management: many behaviors, agitation, wandering, have causes, pain, infection, boredom, or unmet needs, and can often be improved by identifying and addressing the cause. Medical and legal planning: early planning for future care, finances, and advance directives reduces stress later. Caregiver support: caregiving is demanding. Seek support groups, respite care, and professional help when needed. The Alzheimer's Association and National Health Services provide resources and helplines. Part 9: Myths and Important Truths. Quick myth checks. Myth: dementia is just normal aging. False: some memory changes are normal with age. Dementia is a disease process. World Health Organization. Myth: nothing can be done. False: while we can't yet cure most dementias, early diagnosis, symptom management, and lifestyle changes can make a real difference. They're saying the Lancet. Part 10: The Research Horizon and a Hopeful Note. Science is moving fast, from better diagnostic blood tests to trials of new treatments and big public health studies that show prevention is possible. While dementia remains a major challenge, research and community support are expanding the options for diagnosis, care, and risk reduction. Dementia affects minds and lives, but knowledge, compassion, and action make a difference. If this video helped you understand dementia a bit better, please like, share, and subscribe to Atom of Curiosity. If you're worried about someone, encourage a medical checkup, and if you're a caregiver, seek support. Science is working, and every step, medical, social, and personal, matters.